Imagine being completely healthy one moment and then suddenly struck with a devastating illness the next. This is the harrowing reality that Sharon Smith, a vibrant mother of two from Liverpool, England, faced when a sudden, agonizing pain in her chest led to a shocking diagnosis. But here's where it gets controversial. Smith had no prior symptoms, making her story a stark reminder that health can be unpredictable. So, how did this happen? And what can we learn from her experience? Let's dive in. Sharon Smith's journey began in April 2023 when she found herself in the emergency room, clutching her chest in agony. The pain was so severe that it sent her spiraling into a world of medical tests and diagnoses. According to a news release from the Clatterbridge Cancer Center, where Smith was initially treated, the mother of two had been enjoying a vacation in Spain just days before the pain struck. She had even been playing football with her grandson the night before, showing no signs of illness. And this is the part most people miss. Sometimes the body doesn't give us warning signs until it's too late. After a series of blood tests and a bone marrow biopsy, Smith was diagnosed with acute lymphoblastic leukemia, a type of cancer that affects the blood and bone marrow. The Mayo Clinic describes ALL as a rapid progressing disease that creates immature blood cells instead of mature ones. For Smith, the diagnosis was a complete shock. She had been living an active, symptom-free life, making the news even more devastating. Smith's treatment journey was intense. Following her diagnosis, she underwent chemotherapy at the Clatterbridge Cancer Center. In November 2023, she received a stem cell transplant from a donor, a procedure aimed at creating healthy new blood cells and reducing the risk of cancer recurrence. Smith's resilience shone through as she recovered quickly, feeling like her usual self again. But the battle was far from over. In September 2024, during a routine bone marrow biopsy, Smith's cancer returned. The news was devastating, but hope was on the horizon. Dr. Safe, her consultant, had been working behind the scenes to find another treatment option. Smith was accepted for CAR-T therapy, a groundbreaking form of immunotherapy. The American Cancer Society explains that CAR-T therapy involves modifying T cells in the lab to recognize and destroy cancer cells, offering a glimmer of hope even when other treatments fail. Smith's journey to CAR-T therapy was not easy. The treatment was not available in Liverpool until the end of 2024, so she was referred to the Christie in Manchester. The approximately 34-mile journey to Manchester was exhausting, with Smith and her family making the trip about 20 times for consultations, cell collection, chemotherapy, infusion, and follow-up appointments. She also had to stay in Manchester for 3.5 weeks during the most intensive stage of treatment. Despite the challenges, Smith's treatment was successful. Her T cells were collected, transformed into a unique CAR-T treatment, and infused back into her body after chemotherapy preparation. Although she experienced some side effects, Smith recovered quickly. Her bone marrow biopsies and blood tests showed promising results, giving her hope for the future. Smith's story is a testament to the unpredictability of health and the importance of early detection. But it also raises questions. How can we better prepare for such unexpected health crises? And what can we do to support those who find themselves in similar situations? We'd love to hear your thoughts in the comments. Do you agree that health can be unpredictable? Or do you think there are always warning signs? Share your experiences and let's discuss.